Testing, 1, 2, 3. Okay. Let me know when folks are ready. Ready? Good afternoon, I should say good morning. I'm Assembly Member Freddie Rodriguez, and I represent the 53rd Assembly District. Thank you for joining me today to talk about AB 977, a bill that will help prevent workplace violence in our emergency departments. AB 977 is a common sense bill that will protect our healthcare workers and patients. Here with me today to support AB 977 is Dr. David Tursa with the California chapter of College of Emergency Physicians, and Jen Deno with the California Emergency Nurses Association, and Dr. Adam Dougherty with the California Medical Association. As some of you know, I'm a career first responder, and having worked in an ambulance and the ERs on a daily basis for over 30 years, I know the difference AB 977 would make for our healthcare workers, patients, and the quality of healthcare. I've experienced firsthand how the constant threat of workplace violence in the emergency department creates volatility in an already high-stress environment. During one shift in particular, the one that I'll never forget, I heard a commotion as I brought a patient into the emergency room. I looked over and saw a 6-foot, 250-pound patient hitting a nurse who was trying to interfere with her treatment on a patient. Luckily, we were able to safely subdue the person that would have happened if we wouldn't have been there. Think about it to this day. I'll never forget that tragic event. Workplace violence is one of the most dangerous and complex occupational hazards facing our healthcare workers today. For years in California, we have seen our healthcare workers suffering from serious assaults. For example, in 2022, a doctor and 2 nurses were stabbed in June, and another nurse was stabbed in September in LA area hospitals. Workplace violence in hospital emergency departments is rising and increasing healthcare provider burnout rates and PTSD, depression, and lowering the quality of professional life, which all affect providers' abilities to treat patients. Many people think workplace violence is just part of the job, so many healthcare workers don't even report it. One of those to do reports incidents of violence. 2/3 of emergency physicians have been assaulted, and 1/3 of those have led to serious injuries. 85% of emergency physicians think workplace violence in the emergency departments has increased over the past 5 years. And 1/3 of the emergency nurses have considered leaving the job due to workplace violence. With these numbers in mind and our ongoing healthcare worker shortage, I hope my colleagues will support AB 977 on the Assembly floor today. The passage of AB 977 would make the penalty for committing assault or battery against an emergency department healthcare worker inside hospitals equal to the existing penalties for assault and battery that happen outside the emergency departments, and authorize emergency departments to post a message that assault and battery against a healthcare worker is a crime. To talk more about the dangerous occupational hazards facing healthcare workers and the significance of AB 977 is Dr. David Tursa with the California chapter of Emergency College Physicians. And with me is Dr. David. Here we go.
Thank you so much, Assemblymember Rodriguez, for introducing this bill. I'm Dr. David Tursa, speaking on behalf of the California chapter of the American College of Emergency Physicians in support. As some background, I work in the Sacramento area in the emergency room. I'm a practicing board-certified emergency physician, and I've worked across dozens of emergency rooms across the country, from Manhattan to West Texas to Nevada, and now here in California. My friends and family are always surprised to hear the safety concerns that we face every day in the emergency department. But for my nursing and physician colleagues that do this regularly, it is no surprise at all to them. We think and feel the safety concerns every single day that we head into the emergency department. And I'm tremendously excited to support this bill and very excited about it. I'd like to share a little story with you that I'm no stranger to violence and insecurity. Having worked in a number of clinical settings in volatile environments, including Somalia, Zimbabwe, and South Africa. But every single shift that I work in the emergency department, I make a point to carry my wallet and keys with me in the event that I have to flee for my life. and I know that I'm not alone from speaking with other colleagues about this. So kindly ask for your support of this bill, and with that, I'll turn it over to Jen Deno from the ENA. Thanks very much.
Hello, my name is Jen Deno, and I'm here on behalf of the California Emergency Nurses Association and also for Sutter Health to support AB 977. I've been a nurse at Sutter Medical Center, Sacramento, right down the street for the past 25 years, the last 15 of those in the emergency department. Despite workplace violence training, ED staff face acts of violence on a regular basis. During the first 2 quarters of 2023, there were 936 workplace violence incidents reported throughout the Sutter Health system. This has a real impact on staff, and I want to take a few moments to highlight some examples that have happened and are ongoing in our ED. About 10 years ago, an ED tech was watching a patient who had declared themselves suicidal but was not assessed to be a risk to others, when all of a sudden the patient started attacking the tech. The tech was beaten so badly that he had to have 5 reconstructive surgeries to rebuild his face, and he never worked in healthcare again. A few years ago, one of our nurses was punched in the face so hard that it broke her glasses. The person that hit her went to jail for 4 months. When he got out, he came back to the ED as a patient again for a different reason, and she had to take care of him. At that point, all of the staff was scared that they would have to take care of patients that had already harmed us. A week ago, our charge nurse was punched in the face by a patient that the police dropped off in our ED because he was too violent for jail. This is an issue I have been working on with Assemblymember Rodriguez for the past 10 years. In that time, we've done many things to address the problem, including workplace violence committees to address issues that can be fixed, violence assessments that are done at triage so that all staff working with a violent patient will have the knowledge from the chart and a sign by the door, staff education to help workers understand their rights to a safe workplace, added many security and law enforcement in our ED and metal detectors, displayed signage in EDs asking people to help take care of us as we take care of them in a calm manner with zero tolerance for violence and verbal abuse. I'm asking you to support AB 977 today to hold people accountable for hurting us when we are trying to help them, to provide consequences that will help change the culture of violence we have experienced for far too long. Thank you, and I turn it back to Assemblymember Rodriguez.
Thank you, Dr. Tersa and Jen Deno. Once again, there's no reason why penalties for assault or battery against an emergency department healthcare worker inside an emergency department should be weaker than those outside the emergency department. AB 977 will provide the priority we need on crimes committed in and out of emergency department while sending a message to emergency department healthcare workers that their work and safety are valued and the patient's-provider relationship is a priority. So with that, I urge my colleagues to support AB 977 to help our healthcare heroes and patients and strengthen patient-provider trust to drive better healthcare outcomes across California. And once again, thank you all for coming this afternoon and ready to take any questions if there's any. Correct. As working in the EMS field for over 30 years, I can't tell you the numerous times I've witnessed firsthand healthcare workers, in particular the emergency room, being assaulted, beaten by either patients, family, or friends visiting folks in the ER. In one case in particular that I talked about with that 6-foot person, about 250 pounds, had we not intervened, who knows how probably bad she would have been beaten. And I always think about that like it just happened yesterday. So, and it happened across California, right? I've been in many hospitals in Southern California, particularly where I worked, and it happened in every facility I've been to, the stories I hear and the things I've witnessed. So now more than ever, we need to do something about that to show our healthcare workers that there's finally a bill to protect them and the patients and their safety, right? Because we all know that what happens in the emergency room, when those healthcare workers are there to save a life and provide care and treatment, we should provide care and treatment for them too as well. So with that, thank you all for joining us here today, and let's get AB 977 passed into the governor. Thank you.